I'll begin, as I always do, by thanking you, thanking everybody for all that you're doing to comply with our directives, and thanking you for tuning in. This is by far the best place for you to have accurate, up-to-date, fact-based information about the coronavirus here in the state of Rhode Island. Once again, Dr. Nicole Alexander Scott is not here. I am joined by the fantastic Dr. McDonald from the Department of Health. Nicole has a press conference later today with children, so we gave her a little time off for this press event. Another announcement is that on Wednesday of this week, this press conference will happen at 2:30 instead of at 1 o'clock. So every day this week, 1 o'clock, except Wednesday, 2:30. Today, I'm very sad to say we have another 2 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 27 deaths. We have 160 new cases in the state of Rhode Island, bringing us to a total of 1,082. We have 109 people in the hospital. And soon I'll turn it over to Dr. McDonald to describe the specifics of the cases. I've said all along these numbers are going to continue to go up. They're not cause for alarm. They are certainly not cause for panic. They're very consistent with what we are expecting, and I expect every day for the numbers to continue to increase for many weeks. So we're going to be transparent, but it's serious, very serious. More people will get sick, more people will die, unfortunately, more people will be in the hospital. But this increase is not cause for panic. It's totally consistent with what we've been planning for now for over a month. I want to remind everybody, please use your contact tracing notebook every single day. This is an unbelievable tool to keep yourself safe. We have widespread community spread of the virus. Many of us are going to get sick. So if and when you test positive for coronavirus, the first thing you're going to do once you find out you're positive is I want you to pull out your contact tracing journal. And you're going to hand that to the Department of Health so that they can go through that and figure out who else you've been exposed to in the prior days and weeks. Having done this myself now for the past few days, it's hard to remember every place you've been or person you've been with unless you do it every single day. So please, I'm asking you, everybody, get a notebook and at the end of every day, write down with whom you've been in contact and where you've been. Today, I want to begin this press briefing with some really excellent news. Today is a good day in our fight against coronavirus here in the state of Rhode Island. Earlier today, we announced that we have formed a partnership with CVS to make rapid coronavirus testing widely available. This is a new, free, drive-through testing by appointment only, operated by CVS in conjunction with the State of Rhode Island and the Department of Health in the parking lot of the Twin River Casino in Lincoln. The new rapid testing site, this one site alone, at the parking lot of Twin River in Lincoln, has the capacity to test 1,000 people a day. So, and the big news is you will get your result in 15 minutes. So due to this one new site in partnership with CVS, we have quite literally overnight doubled our testing capacity here in the state of Rhode Island. This is a huge announcement. Yesterday, I said we were testing just over 1,000 people. And today, I'm telling you we can test more than 2,000 people a day in Rhode Island. And the results at the CVS site at Twin River will be given to you within 15 minutes. In fact, you will be asked to wait in your car to get your results right then and there. I have to take a minute to thank the men and women who've made this possible. This has been a very long weekend for those of us who've been working to make this happen. Rhode Island is the first state in America to roll this out in partnership with CVS. Today, we in Georgia went live with this sort of initiative with CVS. I expect other states will follow, but often I'm asked for a glimmer of hope, some good news. People are asking, how are we doing compared to other states? The answer is we were the first in the country to get this out. At 2,000 tests a day, we have some of the highest testing per capita in America. It's due to the fact that CVS is here, headquartered in Rhode Island, has been an unbelievable corporate citizen and partner to me and us from day one. This is just one of a number of things they're doing with us, so thank you to CVS. It's due to the unbelievable hard work and smarts and dedication and around-the-clock effort of so many people on my team. Thank you to the National Guard. Thank you to Ken Brindamore, who's working around the clock on this. Just thank you, guys. We had a big weekend this weekend, and I am so proud of you, every one of you who's making it so this could go live today. I want to give you a little bit more information about how this is working. So, and bear with me because I'm going to lay out how all testing is working across the state of Rhode Island. So first, the CVS option. To go get the test at CVS, you do not need to first call your doctor. Go to cvs.com. They have an online reservation system. Go to cvs.com, online reservation system, book yourself an appointment, and then drive to Twin River for the rapid testing when you're told to. You will receive your result in approximately, we'll say, within a half an hour. But as we get up and running, it should be quicker than a half an hour. This site is not for children. You can only go to the CVS site if you're 18 or older. This site really should be used for folks who have to go to work. And it is only for people who have symptoms. So if you have serious symptoms that are consistent with coronavirus symptoms, if you're one of the people who has to work, has to leave the house, and if you're over 18, go to cvs.com, make an appointment, go to Twin River, and you can have this rapid test. Obviously, think of this as like the fast pass, kind of like the easy pass. Not everyone's going to be able to get that, at least not right now. So I want to highlight the other ways you can get tested right now in Rhode Island. We still have testing, swabbing sites, collection sites being operated by the National Guard at CCRI, URI, and Rhode Island College. I want to emphasize the tests that are being done by the Guard at CCRI, RIC, and URI are just as accurate as any place else, as CVS and at the Department of Health. They take longer. Those are being sent out to a commercial lab, and so it'll take a few days by the time we take the swab, send it to the lab, and get the results back. To go to the National Guard sites, you still need an appointment scheduled by your doctor. And by the way, this is where all children should go. So if your kids are sick and you're worried that they have coronavirus, call your pediatrician. If your pediatrician thinks your child should be tested, they will make an appointment with you, for you, at one of the National Guard sites, and you will have the results within a few days. On top of that, we've bulked up our capacity at the Department of Health lab. We're now able to run well over 300 tests a day there, and that number is going up. And we are using that testing for critically ill patients, folks that are in the hospital, people that are in nursing homes, and special situations, because that's a quicker turnaround than sending out to the commercial labs. So just as a recap, if you are a parent of a child and you're worried that your child has symptoms of coronavirus, if you are a basically healthy individual who doesn't have to go to work every day, but you feel that you have symptoms consistent with coronavirus, I need you to pick up the phone and call your doctor, or call your pediatrician, or call a community health clinic, or call an urgent care center. Call them, don't show up, pick up the phone, call the doctor, explain your symptoms, and they will get you to one of the National Guard sites around the state, will get you tested quickly, and you'll have your results within a few days, 1 to 3 days. If you are very sick, an adult, have to work, for whatever set of reasons need a fast turnaround, go to cvs.com, get yourself an appointment. In all of these instances, testing is free. Testing is available to everyone, and I don't want anybody to worry about whether or not you have insurance, whether or not you have money in your pocket, whether or not you're an undocumented immigrant. We want you to get tested. We want to keep you safe. We want to keep you healthy. One final thing, the CVS site is for only Rhode Island residents. So big weekend for us. We had a big push, and I'm so grateful to everybody who made it possible. The CVS testing site is a game changer. I'm sure other states will follow us, and thank you to everybody for all you did to make this a reality. A few other announcements. Yesterday, I spoke about Palm Sunday, and again, I'm sorry that all of us had kind of a unusual Palm Sunday. Obviously, I missed going to Mass as much as anyone and not having the palms in my family. This week is Holy Week, and this is going to be another difficult week, and of course with Easter coming up. So I would just ask you, obviously, continue your prayers. We need prayers now more than ever, and continue to be in touch with your parish. I know different priests and ministers are making services available online, through Facebook, by phone, so I would ask you to just stay in touch with one another and stay in touch with your local church. Today, I also want to recognize that this week is the beginning of Passover, which starts at sundown on Wednesday, so it felt appropriate that I address Passover today. And for members of our Jewish community, again, my heart goes out to you. I know this is a sacred, holy, and very special time of year, and a time of year that you would be accustomed to opening your home for big family gatherings, for a larger Seder than usual. Unfortunately, you cannot do that this year. We need to, and you won't be able to go to synagogue for services, so I apologize that that has to be that way, but it's necessary to keep everybody safe. So I would just let you know that we are thinking of you and sympathetic to how difficult this will be during this week of Passover, and I would just ask you to really limit the size of the family gatherings, just your immediate family who you're already living with anyway, and be in consultation with your rabbi or your synagogue. I know many of them are going to figure out ways to have Zoom services or Facebook or other postings. A little bit more good news as we deal with the battle against coronavirus. I guess it was just about a week ago, every day seems like one long day, we received the news that the United States Congress had passed a $2 trillion federal stimulus package immediately signed by the President. And I again want to say thank you to our federal delegation, without whom that would not have happened. And special thanks to Senator Reid, who's been a phenomenal partner to me in all of this. As part of that package, the federal government and the Congress changed unemployment insurance so that unemployment insurance would begin to be available to workers, to whole classes of workers who typically were ineligible. This is gig economy workers, freelancers, independent contractors, small business owners, hairdressers, a whole category of people in America under the normal set of circumstances are ineligible for unemployment insurance. Late last night, actually very early this morning, we received guidance from the Federal Department of Labor, which now allows us to go ahead and get those checks out. So starting at 8 o'clock tomorrow morning, everyone, including those groups that I just mentioned, can go to the Department of Labor and Training website and file an unemployment insurance application. In addition to that, as part of the federal government's unemployment insurance changes, all workers are entitled to an additional $600 a week benefit from the time of your first check through to July 31st. So let me just take a second, because there'll be a lot of questions about this. If you have been laid off due to this coronavirus crisis, I want you to feel confident that you are eligible for unemployment insurance. Even if in the past you have not been eligible for unemployment insurance, maybe you're a hairdresser, maybe you work from home, you're an independent contractor, you are now eligible. And starting at 8 o'clock tomorrow morning, you can go to the Department of Labor and Training website and file for unemployment insurance. Additionally, they will calculate how much you get a week for unemployment insurance according to the formula based upon how much money you've made in the past. They'll calculate that amount. On top of that amount, for everybody, you'll be receiving another $600 a week every week until July 31st. Please note this is only applicable if you've been laid off. If you decide to leave your job, you will not be covered. You will not get unemployment insurance. As you can imagine, we are crushed with demand. And a huge shout out to Scott Jensen and the fantastic team at the Department of Labor and Training. They're just doing unbelievable work trying to process these checks as fast as possible. Every step that doesn't need to be in the process, we're getting rid of. We're getting extra people to help us answer the phones. We're doing everything we can. So thank you to the Department of Labor and Training. You're awesome. But still, we are receiving tens of thousands of requests a day. But still, I'm begging for patience, because it could easily take us a week to 2 weeks between when you apply and when you actually get your check. And I would just beg you not to keep calling every day to ask on the status of your check, because if you do that, it's just going to slow us down in getting the checks out. If you haven't heard anything within 14 days, if you haven't received your check within 14 days of when your application is complete, then you can go ahead and check in. So this is good news. It's a bit of relief. It's not enough and not fast enough, but we're doing the best we can. And again, I want to thank everybody for staying strong and staying tough in light of these very difficult economic times. And I want to especially thank all the employers out there who are doing the right thing. So many of you are doing the right thing and keeping as many people employed as possible, and I want to thank you. You're being creative, you're being courageous, you're acting quickly. The name of the game now is speed and flexibility. That's how we are operating, that's how a lot of employers are operating, and I want to say thank you to all of you for your cooperation.